Hi guys, my name is Andrey Iskornev and you're watching Sincerely Yours. Today we're gonna talk about Cannes Film Festival. It just ended and it was stunning. Have you seen all those celebrities, all this, glamour and sparkle? Here is the article from Vogue. It says the queens of Cannes are fit, fabulous and over 50. So basically, let's talk about actresses who are older than 50 years old and who look stunning. Okay, we have Demi Moore, she's 61. We have Naomi Campbell, she is 53. We have Isabelle Huppert, 71. Julianne Moore, 63. Salma Hayek, 57. And Uma Thurman, 54. Look at them, they look stunning. So basically, let's talk about their facial routine, because of course, everyone we see on the screen, they do something with their faces, because it's impossible to look that gorgeous without professional involvement of plastic surgeon or dermatologist. Highlights of the most important procedures celebrities normally do before any red carpet. The most obvious thing to do before any red carpet would be Botox. So we do Botox to forehead to get rid of crow's feet. Celebrities with broader face, they also inject Botox to the mesotheric muscle. It relaxes the lower part of the face and it pops up the middle part of the face. So you got this diamond or V-shaped face on a red carpet. Personally, I recommend to do Botox 2-3 months before red carpet, so you wouldn't look, frozen in a frame of paparazzi cameras. Second thing to do would be mesotherapy with, attention, salmon sperm. Basically, 2-3 months ago, I started to notice this new trend with with salmon sperm. But honestly speaking, it's an old molecule. It's a PDRN. It's just nucleotide, which we've been using in mesotherapy for ages. But it's cool to name it salmon sperm. So what is mesotherapy? Basically, it's a number of tiny injections. We inject different types of cocktails into the deeper layer of your skin. It might be a cocktail with collagen, it might be something called hyaluronic acid, or a collagen with peptides. Anything nutritional we would inject to the middle level of your skin, to dermis. This is the level where our skin produce collagen and elastin. So we do a series of injections, series of mesotherapy, 5-6 times once a week, and we finish 2-3 months before red carpet. It makes your skin glowing. We remove wrinkles, especially wrinkles around the eyes, around the nasolabial folds. You just look stunning and fresh. What other procedures celebrities do before the red carpet? Lip plumbing injections with hyaluronic acid. But we don't want to, duck effect. We want to keep our mouth area looking natural. What we're gonna do for lip rejuvenation? Basically, there is a new filler for lips. It contains hyaluronic acid and vitamin B12. B12 vitamin, it heals the cracked skin, it makes your lips look natural, sexy, and hyaluronic acid volumizes your lips. But what about older actresses? Botox is fine, mesotherapy is fine, but when it comes to older actresses, we're gonna need something more powerful. The most powerful injections nowadays would be polylactic acid injections. The technique is basically as a mesotherapy, so it's the same. We inject polylactic acids all around the face, but the effect strikes in 3-4 weeks. Again, we're gonna finish the procedure 1 month before the red carpet in order to reach certain effects. Another procedure which I heard is super popular among actresses in this list. It's called Morpheus 8. It's a highly effective treatment that has been proven to improve skin texture, tone and tightness. Basically, it's a microneedling device that utilizes radio frequency energy to stimulate collagen and elastin. You're gonna need 5 to 8 procedures once in 2 weeks, and also you're gonna finish the last procedure 2 months before the red carpet. So basically, you're gonna be already way in advance. There is one guy in my list, Dustin Hoffman. He looks amazing as well. Guys, you gotta understand, everyone we see in this list, they do something with their faces. I just don't want to be the one claiming this particular actress did a facelift, but when you see 90-degree angle in someone who is over 35 years old, it means that surgical scalpel had been involved. Yeah, but look at Meryl Streep. And she's, how old is she actually? Who cares? Yeah, she's gorgeous. She's over 60 for sure, and she has perfect shape of the face, but she doesn't look operated. It doesn't mean they do not operate, they operate themselves, but it's gonna be done on time, properly, with involvement of deeper layers of the skin. It's called mass lifting. Do you remember the scandal with Demi Moore? Maybe 3, 4, 5 years ago, she looked super weird on a close-ups, but now she's amazing. She's 61. Either it was a recovery period back then that made her look a little bit weird, but now she's stunning. She looks 35, 40 years old. She's 20, 30 years older. Yes, it's a scalpel, but also procedures, as I've just listed. Botox, microneedling, peptides, hyaluronic acid, polylactic acid, and it's gonna be done in a sequence, in a certain sequence that will make you look fresh, natural, and not over-injected. Guys, if you want me to discuss something particular, please comment below, and of course subscribe. Otherwise we won't find each other, right?